This is a historic step, an important step in the repeal of Obamacare and freeing millions of Americans, patients, and local businesses from that pain.
Looking impressive with that gavel, that Congressman Kevin Brady, chair of the House Ways and Means Committee. Are you used to that title yet? That's pretty heavy.
No, not necessarily, but I love this job, and you can make a big difference in a lot of people's lives.
And what was that about?
So that was about, that was the finish of, I think, 14 or 15 hours of the first step in repealing Obamacare, but more importantly, starting the replacement effort to make sure those who are on that law, which today is really kind of collapsing around us, make sure that they have lower premiums and we can transition to affordable care. So that's what that was about.
That still continues to be a pretty big challenge, isn't it? Now,
yeah.
What are the things that are most frustrating to you about the health care, and what are you most happy about at this point?
Well, so there's two steps here. One, we know there are fewer and fewer insurers. In fact, we've had 9 in Texas just leave the state, which no state's lost that many insurers as we have. Those premiums, the monthly costs, went up almost 40% last year. They project something big again this year. People can't afford it. And you're not able to see your local doctors and hospitals. So step one is lower the premiums, make health care affordable for those who are in Obamacare now. Then over the next 3 years transition to get control of health care out of Washington back to the state level, so it's designed for us, and restore the free market so people have broader choices, because right now they just don't have them, and so they can't really pick a plan that's right for them. Those two steps, I think, are critical to making health care affordable.
At this point, what you've put out of the House, I want to talk about something the President said about all the hard work that you put in. You had the big ceremony at the White House. He praised everybody. Everybody was patting everybody on the back. It was a good time. He was talking about replacing. He said at the time, this is a step toward repealing and replacing Obamacare. And then a month later, as the Senate was taking up, he said, what you guys passed was too painful, or that was the word I think he said.
I think.
Mean.
The phrase, not to give you
a
harsh word, but that was what he said.
So how do you deal with that? How do you maintain that kind of respect you need for the leader of your party when those kind of backhanded comments are happening after all of that hoorah?
Yeah, so obviously disagree with the President on that description. We work closely with him to make sure that we're providing more money, especially for those who are at 50 to 64 years old, who don't get health care at work and don't get it through the government like the VA or Medicare. Those are the people we're targeting to help, because right now they just don't have affordable health care. So we did our very best in the House. We're looking forward to the Senate making improvements, strengthening that, helping lower those monthly costs and out-of-pocket costs, and hopefully get it to the President this summer.
Is the President doing the kind of things that you'd want the President to do in this kind of structure? I'm just curious about his involvement. Is he being the kind of leader you'd want the President to do?
So privately, I think he is. The work that I've had with him on health care and tax reform, he's been very encouraging. He's had the team working with us. I've really been pleased with that. On some of the tweets, on some of the public statements, it hasn't been as helpful as I would like, but he's trying to prod Congress into delivering on for Republicans, what's been a 7-year promise to repeal a plan we don't think works for the American public and put in place something that does work in health care. And so a lot of work is left to be done. I'm still confident the Senate can finish their work and help us get this, again, to the President's desk over the next month or so.
It's going to be interesting to see what happens with that, only because there has been this 7 or 8 year process about trying to repeal and replace, and then it's slowing down quite a bit. How easy or difficult is it to distill this whole thing down? There's a lot of moving parts to this.
There is, and it's difficult to do that. And how I try to explain it to my constituents is what we're looking to do is replace Obamacare, this huge bureaucracy, 159 new agencies, commissions, all in between you and your doctor, with the concept of a healthcare backpack where you can choose a plan that's right for you, that can go with you from job to job, state to state, home if you're starting a family or starting a small business, then even in retirement if it works for you. So we're really trying to move control and power from Washington back home here to real people and real small business.
Do you ever see yourselves working together on this? I mean, is it always, you know, that bothers me. You know, I love democracy. I love what this country stands for. And this whole period of time right now, it's just all about you and me, you guys and us guys, and we're not, how can you make something that works best for all of us if everybody's got these distinct, different positions?
Yeah, in healthcare, we really do have different visions of how it should be delivered here at home. But on other parts of healthcare, in fact, there's a lot of good work being done. On the Ways and Means Committee, we continue to pass out packages of healthcare bills developed by Republicans and Democrats together that improve Medicare, Medicare Advantage, help those who are the most fragile in their health care. We do it beautifully, but that doesn't get much attention because that's members of both parties
working together.
Okay. And you know, that's not a fight.
Well, you just have to sing those versions of Kumbaya a little bit louder so you can come in and see what's going on. Hey, Congressman Green was on here earlier, and he talked about the fact he wants to see this president impeached because of the way the firing of the FBI director was handled. Your comments when you hear that kind of talk and what it means?
Yes, so Al Green is a very thoughtful and a very smart legislator. I don't think that resolution is either one of those things. I think there is, from almost the moment Donald Trump was elected, just this anger toward him in a goal to delegitimize his presence. And it began before he was even sworn into office. I see the impeachment approach as more of that. It actually, I think, feeds the anger and some of the discontent and hatred in this country. I think we as lawmakers ought to look for ways to calm that effort because the fact of the matter is we're not at heart an angry nation. We are a very optimistic one. And I still think at the end of the day, whether people support Donald Trump or not, they want their lawmakers to work with him if what happens is good for our state or good for our country. And I think there are ways and opportunities for Democrats and Republicans to work together.
That would be good. I'd wake up one day and I'd be really happy about that, as I'm sure a lot of people would be. Hey, we've got a lot more to talk about, but you only have so much time. So what we're going to do is we're going to do Newsmakers Extra, which means we have more time with Congressman Brady. We're going to talk more about the foreign stage, the challenges this president may face, also how he feels about the media. I don't think he feels so good about me. I just want to find out your thoughts about that and how that can hurt the process going forward for the rest of the country here. So much more with Congressman Brady on Newsmakers Extra. Thank you for being here, Congressman. Always glad to see you here. And thank you for your sacrifices you make on behalf of your constituents. We'll be right back right after this.